me tell you what is possible. Given this information and given the recommendations from the Reopen DC Advisory Committee, we are going to monitor throughout the weekend the trends that we see. And if those trends hold next week, by the end of next week, we will be able to communicate the start of our phased reopening. And so that means everybody needs to pay attention and get ready if we are able to have a phased reopening so that we can do it safely. Tomorrow, we will release a checklist, a reopen checklist, primarily for businesses to understand what they need to do for their business, their employees, and their customers. So please stay tuned for that checklist. We launched a pilot last week focused on education in the arts and student learning for a few businesses across the district. They provided us some information about how they were thinking about reopening, which was helpful for us to read, but also I think helpful to their business colleagues to think about the things that will be necessary to reopen. On Tuesday, we will talk a little bit more about how we will operationalize the committee's recommendations. These are recommendations that don't have the force of guidance or a law or a mayor's order, so we will need to review them very carefully and convert them to the necessary guidance. And finally, barring any peaks that are outside of what the doctor just discussed, we will be in a posture to begin a phased reopening next Friday, May the 29th, in Washington, D.C. Let me be clear about what this is and what it isn't. It is not an on and off switch. We will not be able to go back to life as we enjoyed it in February, but we are incrementally adding activities back in our lives, which we all miss and are all eager to get back to. And staying open and being able to manage this virus means we all have to do our part. Masks are very critical, and it was emphasized to us, to the committee yesterday by Dr. Fauci, how important it was for people to be wearing masks. And even in the activities that we're adding on, how important it is to be wearing masks. Staying home when sick, social distancing when you are out, frequently washing your hands and disinfecting frequently used surfaces, and testing and contact tracing. So part of what we will discuss with testing next week is how your doctors and our community health providers and hospitals and citywide services are all available for testing, but also keeping in your mind, if you are infected, that one of us from DC government, a contact tracer, is going to call you and ask you how we can help stop the spread of disease by tracing your contacts. So just have that in mind, that that's a new thing that will be present in our community, because that work will keep this virus from spreading in our city. So with that, I'll